Well, the city of Henderson wants you to get vaccinated. The Henderson Board of Commissioners has approved a vaccine incentive for up to 1,000 of its residents. Anyone who gets the COVID-19 shot between September 22nd and October 22nd will receive a $100 gift card paid for by the American Rescue Plan. But you have to get the shot at TNT Drugstore, Midway Pharmacy, or Health First Community Health Center. The commission says they took this measure to help increase vaccinations and stop the spread of COVID-19. But despite those incentives, there are still many in the community adverse to getting the vaccine. And it's a huge roadblock to getting the pandemic under control. And the number of COVID patients now hospitalized keeps rising. So what can we do? We put that question to medical experts from Deaconess, Dr. Brad Choi, VP and Chief Medical Officer of Deaconess Clinic, and Dr. Philip Adams, Medical Director of the Access Center at Deaconess Midtown COVID Units. Thank you so much to both of you for joining us today. First of all, give us an idea of the situation in our area right now. What are you seeing in the COVID units at Deaconess?
Yeah, we certainly are seeing a pretty steady number of COVID patients, where I believe today the number was 168. Predominantly unvaccinated patients still. There are a very small number of vaccinated patients that are hospitalized, and even fewer on the bed. The vast majority of those are still unvaccinated.
What about children? We are hearing across the country in the last few days that the number of children getting COVID has risen considerably. Are you seeing that here locally?
So we are seeing that children are getting COVID, but it has not been a large group, or we are not seeing a large increase in hospitalizations as a result of that. There have been more children hospitalized for reasons outside of COVID, but in general, we're not seeing a large rise in the hospital at this time.
And Dr. Adams, what you said about the number of unvaccinated people versus the number of vaccinated people being hospitalized is a huge difference. You know, we're seeing numbers of, 90% of people hospitalized are unvaccinated versus much less than that vaccinated folks that end up in the hospital with COVID. What do you want, how do you convince people to become vaccinated, especially at this point where there are still holdouts, people who just don't want to be? How do you convince them? What do you say?
Sure, that's a very difficult question. Obviously, we want to listen and understand what their concerns are and listen to their reasoning. Obviously, we want to be supportive, but predominantly we're trying to follow the evidence, which is showing that you're about 26 to 28 times more likely to be hospitalized. If you're unvaccinated, you're also much more likely to end up on a ventilator. And certainly the adverse outcomes are much higher in those that are unvaccinated. So, we keep listening and keep trying to encourage people the best we can, and hope that, people will understand that this is really something that's been kind of here to stay until we can, improve our immunization rates among the population.
Well, this is a really timely conversation with you all for me, because just last night I had a phone call I took from a gentleman, one of our viewers, who is very cordial but also very strong in his opinion that he did not want to be vaccinated. He said, these are his words, he does not trust the government, he does not trust Joe Biden, and he does not trust the COVID vaccines, specifically long-term effects. Now, I'm asking you, how do we know this vaccine is safe, and right now and years from now?
Yeah, so I think the important thing to do when someone is feeling really resistant or hesitant is, as Dr. Adams said, really listen to that concern, be empathetic to that concern, and then try to address it with the data, replace some of those myths with the science that we know. And in this case, we do know that these vaccines are the most studied vaccines that have really ever come about, and that we have had millions of patients receive these vaccines under extreme scrutiny, and the data just continues to mount for their safety. So obviously we can't fast forward 5 or 10 years or 15 years from now, but what we do know with high levels of volume, millions of patients, that this just continues to be a safe vaccine. So someone may be able to have all those fears and have all those concerns, but the data continues to be in support of vaccine safety at this point.
The fact that there are still some breakthrough cases with people who are vaccinated, some people say that means those vaccines don't work. How do you respond to that?
Sure, that's a very interesting point. In terms of that, there's none of the of the interventions that we have are 100% effective. So, there's always going to be those rare cases where somebody does get sick that's had a vaccine. They're not 100% effective, but by and large, they're very, very effective, with a rate in the above 90%, which is much more effective than most of the other vaccines. And we've really seen a significant decrease in those cases in those people that have been vaccinated. And certainly, if they do get infected, the severity is much, much less severe than those that are unvaccinated.
All right. I really appreciate both of you taking the time today. And as we leave, I just want to point out that I think the numbers of people who have died from COVID-19 are up to like 660,000 across the U.S. right now. Just something for people to keep in mind when they're considering vaccinations versus being unvaccinated. Dr. Choi, Dr. Adams from Deaconess, thank you so much for spending some time with us today to talk about this important topic. Thank you.
Thank you.